Hello, I'm Dr. Lorayne, and I will be performing your general exam as it pertains to your heart murmur. It's important to understand that murmurs themselves are not a disease. They are a sign or symptom of an underlying condition. But not all heart murmurs are signs of a problem. Some people, especially children or athletes, may have what we call innocent murmurs. These are harmless and simply a result of the normal flow of blood through the heart. However, murmurs can sometimes be a sign of conditions like valve stenosis or insufficiency. Can you lie back on the table, please? Some murmurs happen when your heart muscle contracts. These are called systolic murmurs. Others occur when the heart relaxes, and these are diastolic murmurs. Your murmur is systolic, occurring when the heart contracts. It may be linked to a slight irregularity in one of your heart valves. It's not dangerous, but it does require monitoring and, if necessary, treatment in the future. Now, I'm going to listen to your heart with the stethoscope. I'll start at the aortic area, which is the second right intercostal space just next to your sternum. Breathe normally for me. Good. Now I'll move to the pulmonic area just across on the left side, the second intercostal space. Excellent. I'm now moving down to the third intercostal space, the Erb's point. Very good. Now let's listen over the tricuspid area, the fourth intercostal space. And finally, I'll listen at the mitral, or apex area, which is in the fifth intercostal space, aligned with your middle clavicle. Now, we're going to move on to checking your pulse at various points. I'll start with your neck, where we find the carotid artery. I'll gently place my fingers on either side of your neck, just below your jawline. You'll feel a light pressure as I feel for the rhythm of your pulse. Good. Now let's move on to the femoral artery in your groin. Can you move your leg slightly? Again, you'll feel a light touch. Okay, good. Can you remove your shoes and socks, please? Lastly, let's assess the pulse in your feet, specifically at the dorsalis pedis artery on the top of your foot. This helps us gauge the health of your peripheral circulation. Excellent. The pulses are consistent and strong. Let's continue with a thorough examination of your abdomen. Could you lift your shirt, please? This involves a few steps: inspection, auscultation, percussion, and palpation. First, I'll just visually examine your abdomen to note any visible irregularities. Good. Everything appears normal. Now I'm going to listen to your abdomen with my stethoscope. I'll be listening for two main types of sounds: bowel sounds and vascular sounds. Bowel sounds are produced by the movement of the digestive tract as it propels food through it. They can vary, but typically they're click-clack or gurgling sounds that occur 5 to 30 times per minute. Absent or extremely quiet sounds could indicate an issue, like a blockage, while very loud, high-pitched sounds could suggest inflammation or other digestive problems. Yours are normal. Vascular sounds are produced by the blood as it moves through the arteries and veins. In a healthy person, we typically don't hear these sounds in the abdomen. However, if a blood vessel is narrowed, the turbulent flow can create a swishing sound and could suggest an aneurysm or stenosis. The sounds are normal as expected. Now let's proceed with the percussion. You'll feel a light tapping motion on different areas of your abdomen. When I tap, the sound that comes back tells me what's beneath the surface. If I tap over a gas-filled area like your stomach, it will produce a drum-like sound. If I tap over a solid organ like your liver, the sound will be more muted and dull. Now let's proceed with the palpation. I'll place my hands on your abdomen and apply gentle pressure. This gives me a sense of the size, location, consistency, and tenderness of your internal organs and helps detect any abdominal masses. An enlarged liver or spleen could suggest right-sided heart failure, and a pulsatile abdominal mass could point to an abdominal aortic aneurysm, which is often associated with heart conditions. Good. Nothing's abnormal. Your liver and spleen sizes are within normal range. Okay, you can sit up now. I'm going to recommend an echocardiogram. Have you ever had one before? An echocardiogram is a non-invasive diagnostic test that uses sound waves to create detailed images of your heart. It allows us to view all 4 chambers, the valves and the major blood vessels entering and leaving the heart. We can observe the pattern of blood flow and see how well the heart muscle is contracting. We can even measure the size of the chambers and the thickness of the heart walls. In your case, an echocardiogram can help us understand the exact nature of your heart murmur. It allows us to see if there's any irregularity in the heart valves or chambers that could be causing it. It also helps us assess the severity of the condition, if any, which is crucial for determining the appropriate treatment or monitoring plan. That concludes your examination. We'll schedule your test and then meet again to go over the results. Thank you. Goodbye. Hi, I'm Dr. Lorayne. I understand you're having problems with your back. Can you describe the exact location of the pain? Is it centralized, or does it radiate elsewhere? Okay, that sounds like it could be radicular in nature. Did the pain start suddenly, or was it gradual? Were you lifting something or involved in any strenuous activity when it began? Any numbness, tingling, or weakness in the limbs? All right. We'll proceed with a physical examination now. Firstly, I'll observe your posture and spinal alignment. Please stand up straight for me. There's a slight lean to one side. Now, I'll need you to move in specific ways to assess your range of motion. Let me know if any movement causes discomfort or is limited. Try to bend forward, backward, and side to side. Thank you. Now I'll palpate specific areas of your spine and surrounding muscles. This will help identify any tenderness or muscle spasm. There's some muscle guarding here in the lumbar region. Does this hurt to the touch? Okay. You can sit back down. We're going to conduct a few neurological tests now. This will help assess any nerve involvement. Let's start with your reflexes. I'll be using this small hammer to tap specific areas of your knee and ankle. This is to check the reflexes of your lower limbs. That's your patellar reflex. Reflex seems slightly diminished on the right. Okay, next. That's your Achilles reflex. Both seem symmetrical. Now let's move to muscle strength. I want you to resist my force as I try to move your leg. Push against my hand. Good. Now pull your leg towards you as I try to push it out. Excellent. Muscle strength in the lower limbs seems consistent and strong. Now for sensation. I'll be using 2 different tools, a soft brush and a blunt pin. You'll need to close your eyes and tell me what you feel and where. Do you feel that? Good. Do you feel this? Excellent. How about this? Yes, the brush. Perfect. Sensation seems to be intact. We're going to perform a test called the straight leg raise now. This helps evaluate possible lumbar nerve root irritation, often linked with sciatica-like symptoms. Are you familiar with this test? Okay, please lie back. I'll raise one of your legs while keeping it straight. If you feel any sharp pain or discomfort, especially shooting down the leg, let me know immediately. I'm raising your right leg now. Let me know if you feel any pain. Yes? Okay. I'll lower your leg now. The response you felt might indicate pressure on one of the lumbar nerve roots, possibly from a herniated disc. Given your symptoms and our findings, I'd recommend imaging studies. An X-ray can provide us with a skeletal overview, but an MRI would be more beneficial in visualizing soft tissue structures like discs and nerves. Okay, great. We'll get those scheduled and then reconvene after the results so we can discuss a targeted treatment plan. In the meantime, try to avoid any heavy lifting and consider over-the-counter pain relief if needed. We'll get to the bottom of this together. Take care.